Hello and welcome to Roundtable. You may well be tempted to think that the worst is over when it comes to COVID. Perhaps it is time to think again, with warnings of another wave in Europe and a worrying new mutation, which might make you wonder if this will ever end, or if living with the coronavirus threat is something we will all have to get used to. Good to have you along. I'm David Foster. On this programme, we will hear from the World Health Organization's leading expert in Europe. And we'll look at what we may all have to expect this autumn and winter. The World Health Organization has warned that another 236,000 people could die from COVID-19 in Europe by the beginning of December. The Balkans, the Caucasus, and Central Asia have been hardest hit, and deaths are on the rise. Europe has registered about 1.3 million COVID-19 deaths so far, and 64 million confirmed cases. This week, the World Health Organization named a new COVID variant called the Mu. It was found in Colombia in January and is now present in 39 countries. While other variants such as Alpha, Beta, and Gamma continue to spread, if scientists have got it right, when will a fourth COVID-19 wave hit Europe? Well, on this roundtable, we can head first of all to Geneva, and we see Oksana Pyzik, Global Health Advisor at University College London. Then to Paris, and we welcome Jean-Pierre Thierry, Senior Medical Advisor at France Assos Santé, and then to Copenhagen, and we see Catherine Smalwood from the WHO, the World Health Organization, COVID-19 Incident Manager for Europe. I'm going to split this up, if I may, and I'm going to talk about the Mu virus, the MU virus, in a little while. But I'd like to talk about this prediction, Catherine, if I may, of 236,000 extra deaths by the beginning of December. Do you stand by that number? It's almost 250,000.
It's very difficult to make predictions, and there are several models that are doing it. And this is one of the models that we use regularly. And we hope, of course, that that's not going to be the case. But at the moment, we're seeing deaths increasing. We've seen 14,000 deaths from COVID-19, confirmed COVID-19 deaths in the past 7 days in the European region. And given the context at the moment is that we're seeing very rapid increases in cases, especially in countries where the vaccination uptake is not high. And where the vaccination uptake is not high, that's where we'll be seeing more people in hospital and more people dying.
And is that what has gone wrong? A lack of confidence in the vaccine? Because if you're talking about 236,000 out of 1.3 million deaths so far, that is 1/6 of the entire total going to be losing their lives in the next 3 months. It does seem quite extraordinary.
It does, and I would be reluctant in putting forward any very strong projections in that sense. But what is clear is that the Delta variant, which is now dominant across Europe, has a higher risk of hospitalization, higher risk of death in that case, and more people will die if they're exposed to it compared to previous circulating variants. And in contexts where there's very, very high transmission of the disease, low vaccination uptake, and a continued reluctance to really reimpose these restrictions that countries have relied on in the past, there could be a very deadly few months ahead.
Okay, last one from you for the moment, Catherine, if I may. Which countries were you referring to where there's been, if not an anti-vax movement, then not a great deal of enthusiasm for it, where you think that may be responsible for the seriousness of cases with regard to the Delta?
I would not want to blame it on people who are anti-vaccine or hesitant about the vaccine. This is also about governments and health authorities really reaching out to people who might be hard to reach, people who live in rural settings, who can't access vaccination centers easily. It's of course, every country has a bit of vaccine hesitancy and people who don't want to be vaccinated. But the really big issue here isn't those people. It's the real systems in place to reach out out and get to everybody who really needs to be vaccinated, especially those people who are in priority groups. So people who are over 65, older, who have comorbidities, who are working in frontline services, teachers, people who are working in hospital settings. So all of these people need to really have access to the vaccination, and that governments and strategies for vaccination rollout really need to include those people and reach out to them, not expect everyone to come to you.
Let me stay with you for one more. If it's not an individual's fault, it's a collective problem caused by authorities. Which countries, was my question, are we seeing this lackadaisical approach from?
Well, we're seeing leveling off of vaccine rollout in all countries. And sometimes that leveling off is occurring at very high rates, 80% plus. Some countries in Western Europe, countries like Israel have hit that. But other countries, and we see that in Central Europe, we see it in the Balkans, we see it in Eastern Europe, it's not all about blaming health authorities for not reaching out. It's really a combination of outreach, vaccine supply, hesitancy. Each country has a really broad range of challenges that they're having to face.
I've heard broad challenges, et cetera, many, many times before. I'm going to come to either you, Jean-Pierre, or you, Oksana, whoever, if you like, puts their hand up first. Which countries have got it badly wrong?
Ladies first.
Well, again, I'm just going to draw on what we heard Catherine say, which is there are a variety of errors that were made. So, for instance, like, let's focus on the UK, which has had large success in its early rollout. But I think the impact of those gains made are now starting to some extent level off, in the sense that JCVI has not recommended immunizing teens or adolescents. So we've had really great protection, but with Delta, we see it might not be enough. We might need boosters, which presents problems for the rest of the world. And JCVI is really dragging its feet in terms of vaccinating adolescents, unlike Canada, the US, Japan, Germany, Israel, to name a few. So we are looking at a point where 1 in 7 kids are now seeing that they're having problems post-infection up to 15 weeks afterward. This is under that long COVID umbrella. And I think that's going to not only mean that schools, because they have no other rules in place, no requirements for face masks or for filtration. If you're in a room without a door or window, good luck, you're on your own. And so we're going to see hotspots in schools. The vulnerable, we know vaccines are already less effective than in the young and healthy. And we're looking at a winter where we don't know, with increasing influenza, other co-infections, that hospital rates could increase. In the Balkans, some countries, not all, are facing more problems with the vaccine hesitancy. UK, we have pockets of that, but we've had really good engagement with different religious leaders and engaging BAME groups together to fight that.
So in a sense, it is across the board. Jean-Pierre, let me come to you. It sounds like we've got shifting sands here, that no matter what move you make, you could quite easily be outmaneuvered by the virus because it is going to mutate. And we've got to live with this forever and ever.
Well, at least we have to be very serious about the monitoring of the variants. And I think we'll go back to that later. To go back to France, and I totally agree with just what's said by Oksana and Catherine. And unfortunately, in France, we have heterogeneity of vaccine coverage across regions, and we can see in the regions where the vaccination rate has been not as fast as the other, is very low, like in the French Caribs. Unfortunately, we have the biggest number of hospitalization and severe cases, and we will face a rather high level of mortality. So in France, we can make the difference between the average vaccination rate, which is actually considered as good, because we have to remember that France was considered as a country with the highest level of vaccine hesitancy. We have 63% of the total population vaccinated with 2 doses, and 72 or 73% with 1 dose.
And yet you still think there is a, if you like, call it third, fourth, call it fifth, call it A, B, C, D wave coming.
Actually, in France, we are in the decreasing phase of our fourth wave. So what we're looking at with the Delta variant is a kind of dissociation or decorrelation between the number of cases and the impact of hospitalization and severe cases. Although we have to be very aware that we face the risk of long COVIDs, and we have to fight against the long COVIDs by vaccinating most of the people. And there's a debate about starting with the children. But in France, for the moment, we start at 12 years old.
Okay. Catherine, I know you were a bit reluctant to name and shame, but I'm going to bring up something from Hans Kluge, WHO's Europe director here, who's laying out 3 reasons, perhaps, why things are getting worse.
The first is the more transmissible Delta variant, now reported in 50 countries in the region. The second factor is the easing of public health measures, and the third is the seasonal surge in travel, driving a significant growth in case numbers in most countries. We are seeing a particularly steep increase in cases in the Balkans, the Caucasus, and the Central Asian republics.
I don't want to ask you specifically about what he says there, but I want to ask you this. If we have to learn to live with the ever-changing virus that is COVID-19, could we liken it to what first happened when the common cold came on the scene, maybe millions or hundreds of thousands of years ago? Would it have been a killer there and we got used to it, we learned to live with it? Herpes, our ancestors got it 18 million years ago in my sort of rudimentary research I discovered earlier today. What I'm wondering is, one day we'll be looking at this and think, oh, it's nothing really.
I hope that day will come very soon. Again, I'm really reluctant to make any predictions, but I would be quite confident in betting that SARS-CoV-2 is not going to disappear from the human race anytime soon. And so if we look at the long-term trajectory it'll have, yes, most likely it'll slowly settle into potentially a seasonal disease like the other coronaviruses, which cause common colds. And yes, it is quite possible that those other coronaviruses that we recognize as the common cold were once large pandemics, maybe up until the 19th century. So there are a range of possibilities down the line, but that is one very likely one, and we will learn to live with it. But at the moment, we're in what we call this acute phase, and in the acute phase, this particular virus makes a lot of people die.
Yeah, I totally understand, and I wasn't trying to be flippant. I was just trying to paint some kind of picture of what eventually we might have to live with on a yearly basis. Let's talk about the mu variant, if we may, MU. WHO has said it is, quote, a variant of concern. It is showing, quote, a constellation of mutations that it may allow the virus, to escape immune protection. That sounds pretty nasty. What do you think, Catherine?
So mu is actually not labeled at the moment as a variant of concern, but a variant of interest. So that's, let's say, one level below variant of concern. So Delta is a variant of concern. Mu has just been added to our list of variants of interest. So
I beg your pardon, I misread that. It said you're working out whether it warrants reclassification as a variant of concern. So it's on the next rung down, but a problem?
Potentially. And that's why we're looking very, very closely at the virus and what its trajectory will be. Now, we picked it up in the European region back in June, linked to people traveling from Colombia and other countries in South America. And it hasn't yet shown any substantive scope of replacing Delta, which is the current dominant variant, which is a variant of concern, which we're a little bit more worried about at the moment. So time will tell, but we're looking at it very closely. It's popping up sporadically across Europe in different countries. We're looking closely at that. We're looking at how the variant itself is evolving in terms of the mutations. So it does have certain mutations that would lend to some level of immune escape, but we still don't have huge amounts of information and data around it.
Yeah, but immune escape sounds to me like you can't vaccinate against it. You can't protect people against it.
Not at all. All the vaccines are effective against all of the variants to the best of our knowledge. So against the Delta variant, against mu, there may be some insignificant or significant drop in effectiveness against particular variants that have some level of immune escape, but it's not a binary feature.
Okay. Listen, thank you. Thank you for pointing out some of the things that I didn't quite understand in that. Oksana, let me come to you. What was it, 48 cases of the mu variant in the UK? By the time we are watching this programme on air, it may be more. It doesn't sound very much at all.
Yeah, it was first detected in the UK in about May, and really, as Catherine's highlighted, the cluster of cases has mostly been in Colombia and Ecuador, whereas in the UK, since it was first detected, it's only really accounted for 0.01%, and it hasn't shown to have much growth. And yes, it does have or share some mutations with the previous variants of concern. But it also, the fact that this was picked up means that genomic surveillance program is really effective at identifying this early, and that monitoring is happening. When we compare the growth advantage, it doesn't appear to be able to outcompete Delta at this stage. So I wouldn't be as concerned, and I think the real lesson here is that we need these types of programs, and WHO as well as other collaborators are really picking up with a fine tune these levels of different variants at the appropriate classification.
Okay, I get it. I was reading something that you told my producer here, and I was going to ask you about it. You said growth advantage. Well, in fact, you mentioned it has a growth disadvantage of 11%. In other words, it's roughly 1/10 as slow as the Delta variant in duplicating itself. Is that right? I'm doing this as an infomercial for those people that are reading this and not understanding.
No, but that's based on the data coming out of Colombia at this stage. And so that's, I think, encouraging. But as Catherine said, we have to keep monitoring it. But that disadvantage means it's likely not to outcompete Delta. So Delta remains the #1 top threat.
Okay, Jean-Pierre, Colombia, Ecuador, other parts of South America, not known for their extensive health facilities, many poor rural areas. Is that one thing that is helping this mu variant to spread there that may prevent it from taking hold in wealthier countries?
Well, I think that's under Catherine control. It's one of the criteria looked at by WHO to tag this new variant as of interest. And in France, it has been picked up by the media, and it could appear as very scary to begin with. But on the other hand, the fact that this international cooperation through sequencing and the database that has been put in place, the coordination by WHO, we should be reassured that we are able to look at the appearance of new variants, and we monitor them closely to know what could going on in the near future. And it's reassuring in a way. After the scary reaction, a variant is coming, it's called mu, and it might present immune escape. But in the meantime, the monitor is a good point. For example, in France, Delta represents today almost 100% of all virus sequenced in France. It's 98.7%, and it's almost the same in the French Caribs I was mentioning earlier. So we understand there's competition between variants, as just was said, and this monitoring is important. And one of the issues is not to declare that the war is over, because there's a constant reference to war in this area. And for example, that we have to keep the precautionary measures and the protection like masks, and social distancing. And in France, we have the health pass that also try to mitigate the risk and also represent an incentive for vaccination. And we are not totally, of course, out of the pandemic acute phase, but I think we're progressing in towards a better future.
That's very interesting. How will we know when we're out of the acute phase?
That's good. About the endemic, as you mentioned earlier, but also I understand you put it in the very far future, and I agree with Catherine that if we have a good protection by vaccine, but on a worldwide basis, and part of the population will have natural immunity by contracting the COVID, and hopefully it won't be the people most at risk, although we have to consider the risk of long COVID. At one point, we can imagine that it could be endemic and maybe be closer to the regular flu than the disease we know today, the acute COVID we know today.
Yeah, Catherine, you were, if not smiling in an amused sense, you were smiling in a sort of ironic sense about that. One day it'll go from pandemic to endemic. What were your thoughts?
I was smiling because I don't think it's going to be something that we will be able to pinpoint, actually. I suspect that what's going to happen in different countries, in different parts of the world, is going to be very, very different. And it will happen over a period of time. And different parts of the world will go through very different scenarios, and that will be as much based on their access to the essential tools for COVID-19, such as we're seeing in the vaccine rollout at the moment. This is the first generation of vaccines, and we're seeing the gross inequities that are happening in that course. Some countries with really, they cannot vaccinate because they don't have any vaccine coming in, and that will mean that there will be a big staggering in this shift from kind of pandemic acute phase to less acute.
Let's hear, as we come towards the end of the programme, from Ursula von der Leyen, European Commission President, who's pretty upbeat.
Today, we reached an important milestone in our vaccination campaign. 70% of adults in the European Union are now fully vaccinated. And that is more than 250 million people who are immunized. And this is a great achievement, which really shows what we can do when we work together. But the pandemic is not over, and we must remain vigilant. So first of all, we need many more Europeans to vaccinate rapidly, to avoid a new wave of infections and to stop the emergence of new variants.
Oksana, no matter what she says, here we are at the end of summer. Schools have been out. Now schools are going back. It's going to get colder. It's not going to be necessarily a good winter, is it?
Well, I think we've even had these warnings from government and ministers and scientists before restrictions across many European countries. In the UK, that was July 19th, that, well, we might as well lift now, because if we don't, we won't lift in 2021 at all, because we could be heading into a difficult winter. So again, I think that with half of Europe vaccinated, we've got a ways to go to help build up that vaccine wall. But equally, I think we should be prepared for the fact that some countries that have abandoned all layers of protection may have to return to a layered approach.
So this leads me to ask, perhaps you've just answered it, was Boris Johnson's decision, has it been vindicated? We don't know yet, really, do we?
Time will tell.
Okay. Jean-Pierre, if I can come to you for some kind of summation on this, and we'll go back to you, Catherine, for just a little bit before the end of the programme. Do you think that a certain complacency has crept in and we need now to bang on, or is that just actually going to make people once again say, look, I'm sorry, I've had enough of this?
Oh yeah, there's definitively a pandemic fatigue that we have to address by better communication. Again, if I tended to be seen as optimistic when I was mentioning the international level, it was to push forward the availability of vaccine on a large scale, which is one of the major issues we'll be facing in the near future, in the next years. But I think for countries that has the luck to have all the efforts for vaccination, and again, you're right, to maintain for a certain period the protection measures, you know, that we have to live with in the next few months or maybe a year. I think we're on a good track to control this pandemic, maybe mid-2022.
Okay, so Catherine, final one. I'm afraid you're not going to have very much time on this one. When it comes to vaccine sharing, something that has been emphasised in this programme, on many occasions it's been mentioned with regard to poorer countries in South America, across the African continent, parts of Asia. But are you now saying that some countries in Europe really, really need to be looked at very closely to stop the continent becoming overrun again?
Yeah, in terms of vaccine supply, there are quite big disparities in the European region, just as there are across the world. And it's a little bit odd, but Central Asia features in WHO's European region, and I would highlight Central Asia as a part of the world where vaccine supply has not been sufficient yet. So certainly there are countries that I'd like to bring attention towards for delivery of vaccine. And I completely agree with the points that others have made. It's really a matter of planning to have a fairer system in place to enable countries to all move forward together. And what we have, in fact, is some countries who have the privilege and the resources to move forward faster. And because sometimes there's a herd mentality with countries tend to copy each other. We see sometimes decisions that are made that might not be appropriate for their setting because they don't have access to the same resources as other countries. So that's why I think we all need to move forward together, and why WHO has pushed so hard for this.
Think of others, because then you'll be doing yourself a service as well. Listen, thank you very much indeed for coming on. Thanks for telling us about the Mu variant. Thank you very much indeed, Oksana, Jean-Pierre and Catherine. Thank you. Wherever you happen to be watching this edition of Roundtable, I'm David Foster. We hope to have your company next time. Till then, goodbye.